Top 13 blood clot symptoms you should never ignore. Every 37 seconds, someone in the world dies from a cardiovascular issue, and blood clots are often the hidden culprit. They can block blood flow to critical organs like the heart, brain, or lungs, causing life-threatening emergencies. The most alarming part, blood clots often develop quietly, without obvious symptoms. That's why understanding the early warning signs is crucial. In this video, I'll walk you through 13 specific symptoms that could indicate a dangerous blood clot. Symptom number 1, swelling in one limb. Unexplained swelling in a single arm or leg is a classic sign of a blood clot, specifically deep vein thrombosis, DVT. This occurs when a clot forms in the deep veins, usually in the legs, obstructing normal blood flow. Unlike general swelling caused by injury, this type is typically concentrated, may worsen over time, and isn't relieved by elevating the limb. You may also notice accompanying warmth, redness, or skin discoloration in the area. This symptom is critical to recognize because DVT clots can break loose and travel to the lungs, leading to a pulmonary embolism, PE, a potentially fatal condition. Risk factors for DVT include prolonged sitting, like during long flights, obesity, smoking, and certain medications, including hormonal birth control. If you notice swelling that feels firm, tender, or hot to the touch, consult a healthcare professional immediately. Symptom number 2, sharp chest pain and trouble breathing. Sudden chest pain or unexplained shortness of breath are two of the most alarming signs of a pulmonary embolism, a blood clot in the lungs. This occurs when a clot from another part of the body, often the legs, travels to the lungs and blocks a pulmonary artery. The chest pain may feel sharp, stabbing, and worsen with deep breaths, while the shortness of breath can come on suddenly without exertion. In addition to these, some people experience dizziness, a rapid heartbeat, or even coughing up blood. Pulmonary embolism is a medical emergency that requires immediate attention. Factors that increase the risk include recent surgery, immobility, or a history of DVT. If these symptoms appear suddenly, call emergency services without delay. Symptom number 3, one-sided numbness or weakness. Sudden numbness or weakness on one side of your body is a classic sign of an ischemic stroke, which occurs when a blood clot blocks the flow of blood to the brain. This blockage deprives brain cells of oxygen, leading to neurological symptoms. You may notice numbness or weakness in the face, arm, or leg, commonly on just one side of the body. Along with this, you might experience difficulty speaking, understanding others, or sudden confusion. An ischemic stroke is the most common type of stroke and is often linked to conditions like atrial fibrillation, which increases the risk of clots forming in the heart. High blood pressure, smoking, and diabetes are other major risk factors. Time is critical. If you notice these symptoms, call emergency services immediately. The quicker the treatment, the better the chances of minimizing brain damage. Symptom number 4, severe headache or vision problems. A sudden severe headache that feels different from anything you've experienced before could be a sign of a cerebral venous thrombosis, CVT, a rare but dangerous blood clot in the brain's venous system. This type of headache may be accompanied by vision disturbances, such as blurred vision, double vision, or even temporary vision loss in one eye. What makes this type of blood clot particularly dangerous is that it often mimics symptoms of a migraine or regular headache, leading people to ignore it. Risk factors include dehydration, pregnancy, certain genetic clotting disorders, and prolonged use of oral contraceptives. If a headache is sudden, severe, and accompanied by other symptoms like nausea, confusion, or difficulty balancing, seek emergency medical care. Symptom number 5, swollen feet and ankles. Swelling in the feet and ankles, also called edema, is not always benign. Persistent swelling, especially if it feels firm or looks shiny, may indicate that a blood clot is obstructing the veins and preventing proper blood flow back to the heart. Unlike swelling caused by standing too long, this type doesn't go away with rest and might feel warm to the touch. This symptom is often associated with underlying conditions like heart failure, liver disease, or a history of DVT. You may also notice skin discoloration or see that pressing your finger on the swollen area leaves a temporary dent. Because this can escalate into life-threatening conditions like a pulmonary embolism, it's essential to consult a doctor if you notice prolonged swelling. Symptom number 6, arm pain or heaviness. Unexplained pain or heaviness in your arm can be a warning sign of a coronary thrombosis, a blood clot blocking blood flow to the heart. While chest pain is a well-known symptom of a heart attack, arm pain is often overlooked, but just as critical. This pain may radiate from the chest or occur independently, usually in the left arm, but sometimes in the right or both. The pain can feel like a dull ache, a sense of heaviness, or even sharp discomfort. It may be accompanied by other symptoms such as nausea, sweating, or lightheadedness. This symptom is more common in people with risk factors like high cholesterol, smoking, obesity, or a sedentary lifestyle. Arm pain related to a blood clot is a medical emergency. If you notice this, along with other symptoms like chest discomfort or shortness of breath, call emergency services immediately. Symptom number 7, irregular heartbeat, atrial fibrillation. An irregular or fast heartbeat, also known as atrial fibrillation, AFib, can indicate a blood clot risk. AFib is a condition where the heart's rhythm is erratic, causing blood to pool in the heart chambers. This pooling increases the likelihood of clot formation, which can travel to the brain and cause a stroke. Signs of AFib include a fluttering or pounding sensation in your chest, lightheadedness, fatigue, and sometimes shortness of breath. People with AFib are 5 times more likely to have a stroke compared to those without the condition. Managing AFib with medications, a healthy diet, and regular exercise is essential for reducing the risk of clots. If you experience irregular heartbeats that don't resolve quickly, consult a doctor for proper evaluation and treatment. Symptom number 8, vision loss or blurry vision. Vision problems such as sudden blurry vision or partial loss of vision in one eye could indicate a retinal vein occlusion, RVO, a blood clot blocking the veins in the retina. This condition is more common in people with high blood pressure, diabetes, or high cholesterol. RVO can cause symptoms such as seeing dark spots, flashing lights, or a complete loss of vision in the affected eye. Unlike conditions like dry eyes or temporary strain, RVO requires immediate attention, as untreated clots in the retina can lead to permanent vision loss. Early detection through an eye exam can make a significant difference in treatment outcomes. If you wake up with sudden vision changes or notice these symptoms, see a doctor immediately. Symptom number 9, red or discolored skin. Redness or discoloration of the skin, especially in one specific area, can be a key sign of a blood clot in a vein. This symptom often accompanies deep vein thrombosis, DVT, and occurs because the clot disrupts normal blood flow, causing localized inflammation. The skin may appear reddish or even bluish, depending on the severity of the blockage. Unlike redness from a rash or minor irritation, this type of discoloration is usually confined to one spot, often on the legs. It may feel warm to the touch and is sometimes accompanied by swelling or pain. Conditions like prolonged immobility, surgery, or genetic clotting disorders can increase the likelihood of this symptom. Ignoring such discoloration could lead to serious complications like a pulmonary embolism. Always consult a healthcare professional if you notice sudden skin changes without an obvious cause. Symptom number 10, Tight, swollen abdomen. A swollen or tight abdomen, often described as feeling hard like a basketball, can be a symptom of hepatic vein thrombosis, a condition where blood clots block the veins draining the liver. This swelling, medically referred to as ascites, occurs because the liver cannot process blood effectively, leading to fluid buildup. This condition can also cause abdominal pain, jaundice, yellowing of the skin or eyes, or fatigue. Hepatic vein thrombosis is rare but serious, often linked to conditions like liver disease, clotting disorders, or certain cancers. Swelling that persists or worsens should never be ignored, as it can signal significant underlying problems, including dangerous blood clots. If you experience unexplained abdominal swelling alongside other symptoms, seek medical attention immediately. Symptom number 11. Tender varicose veins. Varicose veins are a common condition, but when they become tender or painful, it may signal a more serious issue: superficial thrombophlebitis, or even deep vein thrombosis, DVT. Varicose veins are weakened veins that struggle to pump blood back to the heart effectively, increasing the risk of clot formation. Signs include pain, tenderness, or a hard lump near a varicose vein. The skin around the vein may also appear red or inflamed. Although superficial clots are less dangerous than DVT, they can increase the risk of deeper, life-threatening clots. Risk factors include prolonged standing, obesity, pregnancy, and hormone therapy. If you notice tender varicose veins with accompanying warmth or swelling, consult a doctor for evaluation and possible treatment. Symptom number 12. Leg cramps while walking. Leg cramps that consistently occur during walking and subside with rest can be a sign of peripheral artery disease, PAD, which is often caused by blood clots or narrowed arteries. This condition restricts blood flow to the muscles, especially in the legs, leading to pain or cramping. Unlike ordinary muscle cramps, these pains are predictable. They tend to occur after walking the same distance or performing similar activities and improve once you stop and rest. You might also notice the skin on your legs appearing pale or bluish, or that your legs feel cold compared to other parts of your body. Risk factors include smoking, diabetes, high cholesterol, and a sedentary lifestyle. PAD increases the likelihood of dangerous clots forming elsewhere in the body, such as the heart or brain. Symptom number 13. Coughing up blood, hemoptysis. Coughing up blood, known medically as hemoptysis, can be a sign of a pulmonary embolism, PE, a blood clot that has traveled to the lungs. This symptom occurs because the blocked blood flow damages lung tissue, causing bleeding in the airways. This alarming symptom is often accompanied by shortness of breath, chest pain that worsens with deep breaths, or a rapid heartbeat. It's most common in people with risk factors like recent surgery, long periods of immobility, or a history of DVT. Hemoptysis is never normal and requires immediate medical attention. While it can be associated with other conditions like infections or lung disease, its connection to blood clots makes it a potential medical emergency. If you or someone you know starts coughing up blood, seek urgent care. Blood clots can develop silently, but recognizing these 13 symptoms could save your life. If you experience any of these signs, consult a doctor immediately. It's always better to act quickly. For more natural ways to dissolve blood clots, check out my recent video on top oils to dissolve blood clots naturally, linked in the description and the I button above. Don't forget to like, subscribe, and hit the bell icon for more health tips.